Next slide, please. Great. So I'm going to quickly touch upon these aspects. Good afternoon to all, respected Jayant Pujari sir and colleagues sir, Shah sir, madam and Raghu, all dear colleagues from various parts of the country from different colleges. I will quickly walk you through what we can do. In fact, from morning onwards, we have been privileged to understand what kind of great work BAS is carrying and what kind of options we have to contribute to BIS. So I will actually going to demonstrate one of those contributions here, so that at organizational level, at institutional level, and also at individual level, how we can empower our standards organization. Probably by the end of my presentation, I think I'll be able to convince you that we all can contribute. So next slide, please. So this is the first thing I think we have to. Okay, this next one. Right, thank you. This is my favorite slide. So now actually there's a big paradigm shift. Actually, Pujari sir is here and privileged to present these aspects in front of sir. So actually the whole NCISF I think is pushing us, their boundaries, working very hard to convince us that the times have changed and we have to change our outlook. Earlier it used to be institutional centric or say authoritarian centric, but now it's up, down, up. It is mostly citizen centric. The whole governance, whole regulation, whole industry, everything is now the citizen centric. So is the healthcare and of course traditional medicine also. The ministry is, I also have worked in the ministry, and council is one of supporting agencies for the ministry. So we work with many organizations and it has multiple dimensions, and I am amazed to say this to you. India is I think only country where you have two health ministries. Very, very interesting aspect. We have a Ministry of Health and Family Welfare at central level, and we also have a Ministry of Ayush who work together. That shows the sheer size of the kind of service we are actually handling, not in terms of budget yet, but when it comes to working with healthcare, we are working shoulder to shoulder. I think hopefully in future even the budget also will match healthcare budget. So next one. This is also similar representative. It generally talks about the information flow. I'll just clip it. So I was just going through, I'm not talking about the definition what sir has given in the morning, but I was actually interested in the literary aspect of it. I was searching for the etymology of what is a standard. It's a French word, old French word, which actually stands for a flag, dhwaja. It is not new. I was surprised. In India, actually if you see Mahabharata and other literature, dhwaja is so important. Krishna has a specific dhwaja and Arjuna has a specific dhwaja for the Ratha. They are very specific symbols. So that kind of specificity is what a standard brings in. So it has a very profound meaning. Pada artha in Ayurveda, we all know Padartha Vijnana, we are taught. So it is a loaded word. Whenever you say standard, we should definitely look into it with great respect. And as repeated here many times, we have a lot of internal standards. I work for the literature institution. So first of all, we look for internal evidence. So it's not new concept. Ayurveda is highly standardized and codified. In fact, WHO recognized Ayurveda as a codified system. The codification itself is equated to standards. So it is not a random thing or say, no, it's not like that. It has very specific construct. And for want of explaining, you all Ayurveda colleagues, I need not explain you this. The very arrangement of 120 chapters in Charaka Sampada is so standardized. There's a very, very specific idea behind arrangement, and as sir has pointed out, that is subject for revision also. Later times, it got revised also for the practical purposes. In fact, if you take the Rasayana aspect, Charaka is loaded with Aindriya Rasayana and some, which are not available, but Ashtanga Hridaya has given Lashuna as a Rasayana, which is big change. That's so practical and so relevant even today also. So that kind of dynamism is there. If somebody says Ayurveda is closed, it is irreducible, that is all defunct. Please don't buy that story. We are the most open, most progressive sciences ever conceived on earth. So these are the internal standards we have. In fact, Kalpa Siddhisthana is full of standards. Full of standards. SOPs, not even standard, how to do, and they are replicable today also. Thanks to Jamnagar School, Maharashtra, where Katti sir, people, great legends, have standardized and trained thousands of students. Many of the small OPD setups have these standardized practices of Panchakarma going on everywhere. That kind of a beautiful standardization we have. And it is time to just put that old wine into the new bottle so that it becomes relevant. So that's what I'm going to talk about. Standards for the current era. So these regulations, these are talked about. I'm not repeating it. So this is what caught my eye because this is my area of work, informatics, and I must congratulate BIS for coming up with such a nice document which has summarized all the informatic requirements and well encapsulated. Please buy this document. Of course, I borrowed it from Raghu. I'm going to buy it soon. It's a very nice document. It talks about, see, this is the marriage of nice engineering practices with the medicine. So that is the beautiful crosstalk we are having. UML documents, process diagrams, these are all good engineering and management concepts which we are now actually utilizing for like recreating our science in these aspects. So these are few examples. For example, Prakriti, IGIBSR has already told, thanks to Bhavna madam and Mithali madam, they have done a very good work. They are the very early pioneers in this work, and now we can see a standard being developed based on that informatics model. It's a wonderful development, nice journey. So these are what I'm going to repeat after madam. It doesn't happen overnight. Standards always are in-house first, then they get outside branding. Any industry, or say even the management of a home, you have an SOP at the home, then it becomes municipalities SOP, then it becomes a city's plan, then it becomes national whatever the policy it is there. So, and most of the NGOs come before the regulation comes, most of the NGOs come up with best practices, then government emulates, brings them into wider consultation, then it becomes a regulation. So in Ayurveda also it's the same thing. It always starts with the basic conceptual study, epistemological, anthropological, cultural, historical studies, then standardization, of course, experimental studies, clinical and utilization. And we have to add another dimension, health technology assessment, because we are using a lot of technology. Even that aspect has to be added. So I was tasked to actually talk about how we can use ICT or artificial intelligence. I added ICT from my end because artificial intelligence is another type of information computational technology. It is not a new thing, it's just an advancement of all the information technology developments. I'll just quickly give the perspective about it. So we had Internet point 1, which was mostly provided by the internet website providers. It was not dynamic. Next came World Wide Web 2, where we can interact with social media. We are pumping a lot of data to the social media, through social media and other media, to the internet. And when you put it to certain learning mechanisms, which replicate human learning process, especially NLP, we get things like generative AI and things like that, which we are now being bombarded with a lot in recent times, from 2022 and onwards. Now that caught the imagination of everybody. Now it has become almost a normative thing. So, but it is so important, and it's happening so quickly. In 2024, almost 5 Nobels were given based on the this one, artificial intelligence. In physics is a very tough field. After the research, after 20-30 years, generally people get Nobel. But within years now, for John Hopfield, Geoffrey Hilton, who are known as father of AI, now they've got Nobel based on their AI work. And chemistry, Demis Habershis, John M. Jumper, and David Baker, for their DeepMind, Google DeepMind and other initiatives, because they could solve the problem of AlphaFold. Now they've got the Nobels. So that's the kind of importance AI is going to have in our futures. We are indispensable. We should know how to use it. There's no other option. So I'm just coming back again to the perspective. A few years back in 2006, when I joined as an SRF in National Institute of Indian Medical Heritage, I joined, it was a serendipity. I was working in an industry. I was very busy producing 200 products in that company. And suddenly there was a vacuum, there was a problem in the company, so I had to join as a SRF. I was wondering, it was a sleepy place, nothing much was happening. It's a literary institution. I was just not sort of relate to what was happening. Then the question was, it was only limited to few scholars. But then we thought, no, it should be taken to different people, and many people should have access to these kind of works. So that's how this quest for digitization of ebooks has started. I think how many of you have accessed digitized Charaka Samhita and others here? Thank you. It's a very good number of hands. So those were done in 2008 and 9. And the idea was very simple. Create one resource. It should be useful for many people, reusable. Everybody should not keep creating it. That was the idea, and they are all in the public domain. So that was the idea. And then the rest of the things have followed. Namaste Portal and other things. And I'll come to that little later. So these are the ebooks. Now they are all in one conglomeration called eGrantha Samuchaya. And Madam already spoke about this. where Ayush Research Portal, I'll just pause a minute with this site. Here we have applied one simple criteria. There is one page document in a WHO evidence document where we could have a small criteria for ABC classification of clinical trials. A, grade, B and C. Some simple application. Now we have lot of clinical articles, especially around 25,000 articles classified as A, B, C. So that kind of if you apply a standard, you can get better quality stuff. Now you know for which studies the randomized trials are attempted and which areas needs attention. So that kind of a quality work you can achieve by application of simple yardstick kind of a thing, which is defined by a certain responsible organization like WHO or ISO. So those are available, and I will spend a little time on this particular aspect, how we have to understand the depth of the problem and come up with the solutions. Defining a problem is not sufficient, you should also solve the problem. Around 2013 or 14, so I chanced upon this, after 2014, there was an NSS document which has given this kind of results. So it says that Ayush was only 4.1%, and that those numbers are very, very pathetic. If you can see, almost 95% they, at that time, in that survey, NSSO survey, they gave the result that around 95% is only allopathy, and these are all completely in the margins. And you see, by application of one revision, recently this 2022-23 survey on Ayush fact sheet has completely reversed it. It is not allopathy versus Ayurveda, but at least it has come up with such a questionnaire by properly defining what Ayurveda and Ayush systems are. Now we understand that almost 40 to 45% in urban and rural areas are utilizing some or other kind of Ayurveda or say Ayush kind of interventions. That is the power of standardization. Thanks to the committee which has worked with the NSSO very closely, Manohar and others, I know them. So they have done a very diligent work, and they had of course, still this work doesn't conclude what exactly share we have in terms of healthcare delivery, but at least it has redefined the perception before and after. In fact, that 71st NSSO was a trigger for Namaste portal. I will come to that. So this is the Namaste portal. So this one reusable resource, again I am coming back to my point that if you create one reusable resource, it can take different dimensions. I am very, very happy to be part of this initiative from conception level till date. One portal, one set of terminologies have helped develop the WHO standardized terminologies, International Classification of Disorders, TM2 chapter, and glossary in the BIS. That was one of the first outcomes of BIS. That is almost a replica of a few chapters of Namaste portal. And it has defined, if you observe the Namaste portal arrangement of content, it adheres to the ontology of Ayurveda. The way we understand Ashtanga Ayurveda is almost replicated there. And next, these procedure codes are about to be developed for International Classification of Health Interventions. That's one of the important requirements we have started working on. We also have supplied data to SNOMED CT for developing Ayush extension. It's already released, Ayurveda, Siddha and Unani. And we have incorporated this as part of the hospital management information system. So that's a kind of beauty with which we can proceed. So it is not the BAS work to do all of this. This is our community's work to begin with. So one of our joint secretaries, Ranjit Kumar sir, was helping me a lot understand about this. So I had one day we had a very good conversation. Thanks to him, he allowed me to speak. In fact, they are very busy people. Saket, we can get it solved. I said, no sir, please allow us to solve the problem. Let us understand. It is our problem. Please just guide us how to navigate through these regulatory maze and other things. Rest we will take care. In fact, he has diligently done, and thanks to then my DG Dhiman sir and later on Kotecha sir, they always have ensured that we were getting that safe space to sit, discuss, deliberate. In fact, we were having a tough problem to work with Ayurveda and Siddha Unani. Earlier, there was not even cross-talk, but with ICD TM2, we could sit together and come up with common disease codes. So that is all possible because of great leaders like Pujari sir now sitting here. I should not praise him in front of him. It's not a probity. But they give us the space, safe space in the ministry to conceive and take these ideas ahead. And thanks to colleagues like you from many, many colleges in our committees, a lot of power comes from academic institutions. You come and sit on our tables, you give such a hard, you do a lot of homework and come and bring back a lot of good discussion to our table, and that's how these documents are formulated. So all this Namaste portal was because of National Institute of Ayurveda, Jaipur, Jamnagar, many other colleges across India. They have helped us shape this particular work. So I'll just quickly run through these slides. Namaste portal is available at namstp.ayush.gov.in. You can browse through that. I will not spend time on that. It covers standardized terminologies, and this is one of the outcomes. WHO could publish standardized terminologies, and these kind of things help BIS to publish further standards in the ISO domain. So this was what I was talking about, glossaries, which is the first publication of BIS in the Ayush sector. And especially as I said, 71st NSSO has triggered this work. That was the reason. The reason which we found out was that the diseases were not reported uniformly across India, the services against versus diseases. That was the biggest lacuna. So we thought if you have a codified list, so the reporting becomes better and our results are more tangible. So this is what has followed. We have national codes now. Now we also have international codes. So this is the perspective on which the Namaste portal works. Again, like BAS, it is an open portal. All the suggestions are welcome. Most of the data is available for free download there. So now I'll pause a little bit at this ICD development. So this is released in this year January for country implementation preparation. That was the preparation, but now final consultations are also over in last month in Malaysia. So now it will be released as an official version to utilize in the mid-January. So after that, we are going to take help of NCISM to reach out to all the colleges to train each and everybody on how to use the morbidity codes in general and ICD-11 codes specifically. So these are the value proposition. What happens if you do all of this? Counting of traditional medicine, health service encounters and measures their form, frequency, effectiveness, safety, quality outcomes, and cost nationally and internationally. So Namaste portal is already available. Comparability, we are working with CTRI. We already have this Namaste codes as part of CTRI, our Clinical Trial Registry of India portal. And we have hospital management system to capture data at point of care. And pharmacovigilance program, we are encouraging them to use these codes. And also standard terminologies, benchmark documents, all these are the outcomes of such initiatives. So this is the journey of ICD-11, started in 2010, almost a 15-year journey. Now we have realized our goal. So that's the beauty of it. So I'll just quickly run through these slides. So now it is in the maintenance platform. The chapter 26, module 2 is traditional medicine chapter. So you can have a good round of applause for that. It's a great achievement for India. So what we do is, you see, earlier it is like you recognize me. No, it's not that. You be in the right place, everybody will start recognizing. Now, International Classification of Disorders is one such platform. And it comes with a great power of terminology as part of the entire medical terminology. Now, we are not a separate, we are a supplementary chapter to the main medical system. So, the kind of talk we do in the terms of integration of medicine and also, integration starts at this very basic level with the crosstalk. So those so-called biomedical doctors should understand what we are talking and vice versa. In fact, we can understand both lingo, but it's very difficult for them. As Sir has mentioned in the morning, that neurologist who said that I'm not a trained researcher, I'm a person who can utilize research. So they are very focused. I mean, that's how they are trained. So if they have to listen to us, at least the arrangement of knowledge system should be familiar to them. Then once they get attention, they will study and understand our work. So these are the chapters. We have 11 disorder sections and around 6 patterns. So I'm also happy to inform you. As I said, the promise of keeping the traditional medicine flavor is not diluted here. For example, if you want to see Vata Prakriti, you have a code in ICD-11. Pitta Prakriti, you have a code here, and they are all part of pattern. Even Agni, Vishamagni, Samagni also has a code in the International Classifications and Namaste portal. So nothing is diluted. That is the possibility. If you can convince across the board, so it is very much definable and codable. This is the path for our integrative medicine. I'm not getting into that. So this is the digital infrastructure. Thanks to Ministry of Ayush. Again, I would like to inform the audience, thanks to the initiatives, rigorous pursuance of Vaidya Rajesh Kotecha sir, that this Ayush digital health platform is enabling us. It is not just, as I said, openness and availability of information is very important. If we do things at our level and keep in the published books, nothing is going to happen. So this digital infrastructure is going to be our vehicle. And NCISM, again NCH, they have already embraced it a couple of years back, this education learning management portal on which all the teacher codes and all these transactions are happening is one of the early initiatives of this Ayush Grid platform. These are the sorry, use cases. And Namaste portal has already incorporated this as part of the portal, TM2. So this one slide I want you to all please, at what you can do at college level. So unfortunately we are losing because of not reporting. Whatever are the genuine cases, my humble request to the audience here is please publish case reports. Case reports become case series, case series become trials. So everybody jumps straight away to the trials. Please, I'm sorry, it doesn't happen like that. Please publish case reports. You have a lot of case reports, but they go unnoticed. Second is maintain at least a minimum set of data on the patient record. This will change our entire outlook of ourselves and also how we present to the world. So please see that you have a nice, well-maintained medical records department in each of your college. I think it's a part of regulation, but that's one of the least maintained departments in most of the colleges. Please reverse it back and you will see the results and employ people there. It's good to pay them, and that will pay a lot of dividends for the whole system. And use very good health record systems, electronic and other systems. We'll come back to this. This is not the platform for that. We have standards for that also. FHIR, we have a National Resource Center for Electronic Health Standards in Pune, CDAC. So they also guide us a lot in this. And what is the AHMS I have shown is complaint of them. This is the clinical trial repository, and please use these codes as part of your research publication. So this is one of the early papers which has used Namaste codes. You can see here, it's Unani, Ayurveda. They have used the codes as part of the research publication. And now work is also going on in the ministry to incorporate Ayush systems, especially Ayurveda packages in the Pradhan Mantri Jan Arogya Yojana, one of the biggest public health insurance programs. There they have the list already incorporated the TM2 codes as part of the exercises. This is one of the examples of that. And finally, this is how we operate, primary, secondary and tertiary. Everywhere if we apply these basic standards, so it's going to have a big impact in our sector. This already we spoke about. Yes, but with a pinch of salt, any ICT or digital technology is risk prone. Like any other tool, Shastram Shastram, we are all aware of that. We are told even water we have to use very carefully, otherwise it will kill. It's as toxic as any other substance, only dose is the problem. Dose and timing, that's it. So is the case with the technology, because our minds are biased. So that's how we need to have consensus, we need to have openness. Needless to say, that's well discussed in Ayurveda also. We know Pratyaksham is Alpam and Anumana is Analpam. So that's where all these consultations and all these things matter. So, and for especially AI, WHO, ITU, International Telecommunications Union, and now WIPO. So they have a very good topic group on traditional medicine. Again, thanks to Kotecha sir. We could go to Helsinki and convince them to have a topic group, and I'm the driver for that. So we could come up with a policy document. As of now, it's going to be published. So there are very good guidelines from WHO to how to use responsible AI. We need not worry. There are methods to use it and come with a lot of good benchmarking. So I'm just running through these slides. So we are expecting this document very soon, and after followed by this we are going to have benchmarking. For example, if we are using AI in Prakriti diagnosis, so what kind of benchmarks it should have. So those kind of standards are being worked out under this initiative. We have good courses also. I would like to request you all to visit WHO website. One Health website is there. There are very good free courses available. Please venture into that and encourage your students to pursue these courses, and they will help us. So don't lament if a student comes with a ChatGPT answer and you should not get perplexed. You should be ready with how to evaluate it, and there are very good sources for that. Free sources are available. So please, this is the time for us to update and get. And this is the same for a teenager and for us also. It is coming to all of us in the same manner. So don't think that it is a new thing. It is going to have the same impact for any age group. Whether you are a faculty member or a student, it's going to have the same impact. So let us embrace it than get deterred. So my final take including my colleagues and everybody here, is that at individual level, at institutional level, I think this is what we should do. Align with the needs of the current time and vision of leadership. That's very important. Do your homework and demonstrate the idea with proof of concept. Lecturing will not work. And I have come up with one small POC to my DG then. What I did is combine two sets of data. One is ITRA data and one is the National Institute of Jaipur data. One Excel sheet convinced him to take up this project in council first before the ministry took up. Then rest is history, we could have the Namaste portal. Any number of lamenting and lecturing will not happen. One proof of concept is what is required. Keep the requirements realistic. Convince the leadership to develop a lean team. Please convince. You cannot complain. You have to convince. There is no other option. They are busy people. You have to come up with good presentations. Don't waste the time. And then you will get whatever the resources you want. Once government decides, it is nothing like, I must tell you, they can do anything. But it's only a matter of you going to them and convince them. Never do it alone, build the team. This is very important. Heroism will not work. That will definitely fail. Please work as a team, and infrastructure and support system to sustain the momentum. It should not be like an open and shut case. It should have a long shelf life. It should continue. The sustainability matters. And finally, standardization, development of standards is the need of the hour. There is no going back, and we also have to support BIS in this. On that note, thank you all for this wonderful opportunity. Thank you so much, and namaste. And my sincere thanks to DG sir and Raghu for helping me come here on a very short note. Otherwise, probably I would have not